Morning, everyone. I'm Darren White, the Warden of Dufferin County. I'm joined today by Tom Reid, Chief Paramedics for the County of Dufferin. Welcome, Tom, and thanks for joining me again. It seems like we've come full circle in videos. I think when we started these videos months back, what seems like years ago now, this was the first video we shot as well with the Chief of Paramedics. So welcome. How are you doing today, and how are our staff doing today? I can only imagine they've had an interesting 4 or 5 months.
Yeah, well, like you said, it seems like a lifetime, and things have changed, and we've continued to sort of pivot as different things came each day. It's definitely been exciting, not boring, and I'd say that the staff are doing pretty well. I would say that I'm always very proud of the team we have at our paramedic service, and quite frankly, I'm pretty proud of the paramedics right across the province of Ontario. When crisis has hit, they've done a great job to respond, and not only on 911 calls, but from our community paramedics, just for a wide range of response for our community. So I'd say they're doing well, and are happy to see us moving into stage 3 in Ontario in our area.
Yeah, for sure. So let's talk about calls for a second. When you look at the breakdown of calls locally in Dufferin County, like how much of a percentage on a daily or weekly basis would you think would be sort of directly COVID related, or there is a serious concern that it could possibly be COVID related?
So as the screening process works for our communication center, about 50% of the calls that are coming in are COVID positive, which means they have some form of COVID-like symptoms or any symptom that may be considered COVID. So unfortunately, we have to treat every case. And right now, our paramedics continue to wear full PPE, which includes a gown, a mask, eye protection on every call until they're able to confirm or at least decide whether or not how high the risk is and whether they have to continue to wear PPE. So more than 50% of the calls come across as positive, so we have to treat them as if they are. And so that, especially during this temperature and humidity, can be quite difficult.
Yeah, I had the occasion way back in the beginning of this to just by accident be on the same street as a paramedic call when this was rolling out, and it was both interesting and scary to see when the paramedics rolled up what they had to do to be prepared to go into somebody's house. And I can imagine how uncomfortable it must be for them in that position. So, and certainly in 30, 32, 35 degree weather, I give credit to you and your staff for just continuing to do this. And generally, what most people don't understand is with a smile on your face. Most of our people are just so happy to be doing their job and to be serving people and to be helping out. And it's really encouraging when that's what shows up at your door when you're in crisis. So I can imagine that creates a lot of stress. What do you think the mental health of the community is? How is that playing a role in your calls now? And what do you think people should know about where they can get additional help should they need it, whether that's your staff or whether that's members of the public?
Well, I guess a couple of different things. It is good. We got a great group, and they do have a great sense of humor and love people. So and most of them love what they do. So that's great. And thanks for commenting on that, Warden. I would say that our staff are in a pretty good place, but again, we've taken big steps to support that. The staff have stepped up and they provided peer support teams, and we obviously have places and numbers they can call if they employ any assistance programs, number of different things, but primarily they really lean on the peer support group that support one another. And again, they're a close-knit group, so they do work really well together and support one another. And through this stressful time, I wouldn't want to say it's all been smiles and giggles, because there has been some really tough times and some folks that have lots of family that and themselves that have medical conditions that certainly they felt the risk of COVID, and it is stressful. And as far as the community goes, I know that it's very alarming for the last last 4 months to be isolated. I think of our elderly. I consider, I think of folks at risk, or domestic violence. So we have seen some of that in our community, as well as mental health and addictions. And so we definitely saw a decrease in the amount of calls that we've had in our community over that period of time, but now we're starting to see them increase. So particularly in mental health and addictions, I would, encourage everyone to try and reach out if they are having concerns, if they know someone to have concerns, whether that's their primary care physician, whether that's at Headwaters at our local hospital, whether that's community mental health, child and family services. We do have hotlines that I'd be able to provide you numbers with that would be able to, it doesn't matter which one of our community partners you go to, that you're most comfortable discussing things with, they can get you help. We do have services available here in the community, and we meet quite regularly to make sure that they are accessible to every member that needs it. And they can be done in a very confidential way so that, whether you're at risk or whether you just, confidentiality will be maintained.
It's important. People should know as well where they can get some of that information. A lot of that they can get from the County of Dufferin website or through the different communication channels that we have. Our communication staff are very good at pushing out that information of additional service, whether it's federal, provincial, or local, whether it's mental health or financial or anything. They've been fantastic through this in trying to push out as much information in a simple, easy to read format as possible.
Absolutely. They've been doing a great job.
Anybody who's struggling can sort of look there and find it. And that sort of covers almost everything I wanted to chat with you about today. But I also want people to understand that from a public perspective, when they look at what's happening in the community, I want them to understand exactly, the command table sort of aspect behind the scenes. There's a lot of work goes on behind the scenes. And I will say you and your staff, and you in particular, have really stepped up to the forefront and taken on roles that are not really covered in your job description. And you've done a lot of things that people just aren't gonna understand, especially around the Shelburne residents and our long-term care homes, and the support you've offered there, the support your staff has done, and they've really jumped into jobs when they've been asked to do something maybe a little bit extra or a little bit outside. And, and I think that goes for a lot of our staff, particularly along our sort of mid-management team as well. And it's really important for people to know that, our staff has been really flexible and really, really responsive. And I'm really, really proud of the work that has been done by staff over this past 5 months. What are your thoughts sort of along that line? And I'm not trying to blow.
Well, I know. I really appreciate Warden, you commenting on that, but I do have to say that not only am I proud of my own staff we used to have a joke that we used to call our service grout, so we just got to fill the gaps, and certainly that's what we've tried to do, and but I can say that's what I'm always so proud of our area, Dufferin County. I'm so proud of the leadership at the county, including yourself, politically, and the management group, because they give us the latitude to be able to sort of work outside the box. And that's what needs to happen. For example, when we were really short on PPE, I was so proud to see the hospital, the county, and all of our community partners come together to make sure that the folks on the front line that were having the greatest amount of risk were protected. And there's all kinds of stories. So I know when we move forward, we'll have to try and document some of these great things, because when we move forward, we don't want to forget all these great things that are working together and the efficiencies that we've created.
Yeah, for sure. Our community has really changed, and there's so many people who've stepped up and in roles that you never expected them to, whether it's a restaurant owner or a business owner or just a guy on the street who has changed their entire life to be of service to somebody or somehow. And it's really, and in the face of so much despair and upheaval, it's been so positive to see that kind of thing happen. So,
absolutely uplifting.
Yeah, so let's leave it on that. I mean, that's seems like a real positive note to leave it on.
I look
And
forward to doing better.
yeah, I wish you guys your service and thank all the men and women of the service for me for their outstanding work. And I wish you all the best as we continue to go into, what continues to unfortunately be uncertain times, but looking generally to be more positive than they were a couple of months ago.
Absolutely, they are.
Yeah,
Thank
so
you
thanks,
very
Tom,
much.
for joining me today. And again, pass on my thanks and my congratulations to the staff.
I will do so.
Uh,
Thanks again. It was my pleasure.
We'll talk to you soon.